Hello, and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, please feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com.
We would like to start our show by acknowledging that we are in the unceded territory of the Snuneymuxw people, with a broadcasting range that overlaps the Cowichan and Sliammon territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages.
Hello, everyone. Thank you for tuning in today. My name is Lara, and I will be your host, joined by my co-hosts, Lauren, Nicole, and Jamie. In today's episode, we will be discussing the health of our healthcare system, with a focus on allyship and safe, accessible care for our Two-Spirit LGBTQIA+ community. Later in our episode, I will be sitting down with Emily Wyatt, Royal Jubilee Hospital's first ever Two-Spirit LGBTQIA+ liaison nurse. First, we will hear from Jamie, who will provide us with a historical context in relation to our gender diverse and trans community.
Hello, it's Jamie here, and I would like to dive into the rich history and context of the 2SLGBTQIA+ population in Canada, with a focus on British Columbia. Before we get in, I would like to take a moment to define this acronym, 2SLGBTQIA+. According to the Canadian Encyclopedia, the 2S refers to Two-Spirit, a term used by Indigenous North Americans to describe a gender role that is distinct from male or female, holding significant cultural meaning in many Indigenous communities. Understanding this context is crucial to understanding the diverse experiences within Canada's 2SLGBTQIA+ population. Canada's relationship with the 2SLGBTQIA+ community has evolved significantly over time. As historian Gary Kinsman explains in his book, The Regulation of Desire, Canada's laws were initially shaped by British colonial traditions, and until 1969, homosexuality was a criminal offense. The first major breakthrough for the SLGBTQIA+ community came in 1969 with the decriminalization of homosexuality, a moment considered pivotal in the history of LGBTQ+ rights in Canada. This shift followed the infamous 1967 gross indecency case involving Everett Clippert, who was imprisoned for being gay. Legal scholars such as Backhouse in Carnal Crimes points out that this case attracted national attention and pushed Prime Minister Pierre Trudeau to introduce legislation that decriminalized homosexuality, famously declaring, "There's no place for the state in the bedrooms of the nation." Despite decriminalization, acceptance was slow to follow. Activists, including those from groups documented by sociologist Marianne Smith, noted that throughout 1970s and 1980s, the 2SLGBTQIA+ community in Canada continued to face widespread discrimination, harassment from police, and social marginalization. In Vancouver, one of British Columbia's largest cities, organizations like the Gay Alliance Towards Equality and the Vancouver Lesbian Connection became crucial in advocating for LGBTQ+ rights. These groups set the stage for broader rights. In the 1980s, Vancouver also played a central role in the fight against AIDS crisis. According to journalist and historian Tom Warner, the AIDS epidemic hit Canada hard, disproportionately affecting gay men. Community members mobilized to demand better healthcare, social services, and public understanding of the disease. Warner's work highlights how this period saw healthcare advocacy aligning more closely with LGBTQ+ rights, particularly as governments were slow to address the crisis. British Columbia's colonial history also plays a crucial role in the struggles of the Two-Spirit community. As described in Indigenous research by scholars like Dr. Gregory Smithers, the pre-colonial recognition and respect for Two-Spirit people were disrupted by colonial laws and Christian missionary influences, which imposed rigid gender roles and homophobia. This elimination of Two-Spirit identities, as documented in Indigenous cultural studies, criminalized traditional roles and introduced exclusion. In recent years, however, organizations such as the Two-Spirit Society of BC have worked to reclaim this identity and foster cultural revitalization. These efforts aim to create spaces for Two-Spirit people and raise their visibility. Significant strides towards equality were made in the 1990s. As noted by the Canadian Civil Liberties Association, in 1996, sexual orientation was added as a prohibited ground for discrimination in the Canadian Human Rights Act. British Columbia became a leader in advancing LGBTQ+ rights in 2003, when it was one of the first provinces to legalize same-sex marriage following a court ruling. This legal victory set the stage for national recognition, and in 2005, Canada became the fourth country in the world to legalize same-sex marriage nationwide. Although marriage equality was a major milestone, the fight for full equality, particularly for transgender and non-binary individuals, continues. The Trans Pulse Canada research project shows that even with legal protections, trans people in British Columbia face ongoing discrimination in healthcare, employment, and housing. In 2016, the federal government amended the Canadian Human Rights Act to include gender identity and expression as protected categories, offering new protections to trans individuals. However, Trans Pulse data reveals that these legal changes have yet to fully address the social barriers faced by the community. The experiences of the SLGBTQIA+ population also reflect the overlapping challenges of race, class, gender identity, and sexual orientation. As outlined by Kimberly Crenshaw's theory of intersectionality, people at these intersections of identities often experience compounded discrimination. This concept is critical for understanding the complexities faced by the 2SLGBTQIA+ community in both Canada and BC today, where marginalized identities often intersect. Today, the SLGBTQIA+ community in Canada and BC continues to push for greater equality and inclusion. Events like Vancouver's Pride Parade, originally established as protests, have become symbols of celebration and reflection on the work still needed. As noted by local Pride organizers, these events serve as a reminder of the ongoing struggles for visibility, safety, and equality. Canada's progress is internationally recognized, and the country is often seen as a leader in the LGBTQ+ rights. Government policies aimed at reducing discrimination and providing gender-affirming healthcare are evidence of this commitment. However, advocacy groups, including Egal Canada, continue to stress that work is far from complete. Issues like mental health disparities, homelessness among LGBTQ+ youth, and access to inclusive healthcare remain significant challenges. As I wrap up this segment, it is clear that the history of the 2SLGBTQIA+ community in Canada and BC is one of struggle, resilience, and triumph. From the early efforts to decriminalize homosexuality to the current fights for broader inclusion, this community has continually pushed Canada to become a more just and equal society. Once again, this is Jamie. Thanks for tuning into my segment on the LGBTQIA plus history and context within Canada and British Columbia. Thank you.
Thanks to Jamie for providing all of that historical context.
Are you curious about trending health topics in your community? Want to learn more about how you can better your own health? Listen to A Sound Constitution on CHLY 101.7 FM every Thursday from 2 to 3 p.m.
Now I'm excited to introduce our interviewee today, Emily Wyatt. Emily is a registered nurse with experience in emergency and gender-affirming care, and lived experience as a member of the Two-Spirit LGBTQIA+ community as a trans woman. She's also a previous graduate of VIU. Her role provides the first hospital-based service of its kind here in BC, and her work helps to reduce barriers for gender diverse and trans patients, clients, families, and facilitates access to crucial life-saving health services. So thank you so much for joining us today, Emily. We really appreciate your time and you being willing to do this interview with us. And I just wanted to start by asking what inspired you to study nursing in the first place?
So happy to be here. So happy to be on. And I think, if I were to sum it up, the biggest thing that inspired me, it's partly my mom who was a nurse, but also the opportunity to hopefully find ways to support and care for my community. And for me, that's turned out to be very directly my community, as in the queer and trans community, which is very special for me.
That's so incredible. It's so wonderful to be able to help your own community as well as the broader, right?
Mm-hmm.
Can you tell our listeners a little bit more about yourself and also the new role that you're currently in as a nurse here for Island Health?
Yeah, so I'm a 32-year-old trans woman. I graduated from VIU a few years ago now, and I have worked with many different groups doing education for healthcare providers in providing care to queer and trans individuals. And I've been a kind of lifelong activist and for queer rights and health issues. Basically, all of my family, my chosen family, everyone close to me is from this community, and they mean the world to me, which kind of plays into a lot of the work that I do. But before doing the role that I was in, I was an emergency nurse for a few years, which I really enjoyed doing a lot of the time, but it wasn't great on my health. And so after some time off of work, this idea came to me. And so I had the opportunity to work with a bunch of amazing individuals within Island Health that helped make this a reality. And so it's a 2SLGBTQIA liaison nurse. Essentially, the idea is to be able to provide support, whatever the patient needs in that moment. It's very diverse, but with the underlying principles of just patient safety and respect and meeting patients where they're at and meeting the goals that they set for themselves.
Beautiful. Thank you so much for sharing all that. I really appreciate it. And an increasingly relevant topic of discussion in society in general is equitable access to healthcare for all. And I'm just curious what your thoughts are on how our system currently supports the rights of marginalized patients and perhaps what could be done better.
I think overall, it does a very bad job at it, if I'm honest. And, sometimes that can sound weird saying as somebody a part of that system presently. Realistically, the role that I'm doing, it is to an extent a band-aid fix. It's because things have gotten so bad that we need to sort of play catch up. And what I see on the daily basis is that patients are having multiple interactions from my community, but also most marginal communities, and more so intersectional communities where you have people from multiple different equity deserving groups. And so we see those people, try to get care multiple times, and for a variety of reasons, they don't get it. And essentially that leads to them just getting sicker and sicker, and oftentimes ends up with them being brought into the emergency room in critical condition. And if we're on the luckier end of that, they end up in ICU, and they do eventually recover. And so we're sort of walking back from that at the moment, where we're still only catching people, a few iterations into this cycle, when in my ideal world, we'd be catching them ideally before this happens, but at worst case scenario, in the first encounter, we'd be intervening and helping. And I think the biggest thing, I mean, I could talk about this for hours, so I will kind of keep it short, but the history of how we've trained healthcare providers and how we've set up the system has made it really difficult for people from a diverse set of backgrounds to become doctors, to become nurses, to become physiotherapists, and so on and so forth. We're seeing some of that kind of improve. Like women and men being doctors is about kind of close to 50-50 now. But other groups, like people of color and queer people and neurodivergent people, are not anywhere near those numbers. And so I think really looking at beyond just the healthcare system, how are we educating, and who are we encouraging to come in, who has the privilege to be able to take time off of work and to afford to go to school to work in these positions. And the privilege that comes from having people care for you that look like you, that are from your community, is so massive and makes a huge difference in the quality of care that people receive.
Yeah, it sounds like really that preparation piece and making the educational pathways more accessible to more communities would make a huge difference here, right?
Yeah. Absolutely.
Mm-hmm. Now, you've touched on this already a little bit, but I just want to see if there's anything else you'd like to add in terms of what influenced you to pursue and establish your current role as a Two-Spirit LGBTQIA liaison nurse for Island Health.
It was definitely an idea that I had sort of brewing in my mind for quite a while, from as early as when I was in nursing school. It wasn't quite solidified, and I was trying to grasp at what that actually would look like. It wasn't until I went to Montreal for surgery. I ended up getting quite ill, and so I've already had a lot of interactions with the healthcare system as a patient. But this is the first time in my adult life that I had been moved to a hospital through the emergency room, admitted in quite critical condition. That experience for me being in a place where I don't unfortunately speak much French, but I also didn't know anybody. My partner was at home because the plan was for them to come pick me up. So I was alone, and I didn't have any supports. And I didn't have any of the resources that I relied on and collected. And I realized how terrifying that is and how isolating that is when you're in the hospital. And then fast forward to me eventually returning to work quite slowly and dealing with, longer term chronic health complications that I still am dealing with. Taking a step back and not going from fire to fire and having a bit more time to evaluate my environment. And I saw that cycle that I kind of mentioned, where people come in over and over again, and then I would see them, unfortunately, in our trauma room. And so I started trying to make some changes in our department that went well. And somebody said to me, like, hey, it'd be really cool if we had a liaison role. And I was like, yeah, that is something I thought about before. And so I actually sat down, did the literature review, connected with the community, connected with um, members of Island Health's project team and directors, and we made this a reality.
Wow, that's incredible. And so was there just to expand on that a little bit more, you wrote a literature review? I'm really into research, so I can't help but so did you write a grant proposal as well to make it all happen?
Yeah. So yeah, we wrote a proposal. Well, I don't remember what Island Health calls it, but essentially we wrote a proposal for the position, and yeah, went through a lot of research, which was challenging. I like doing it, but it's also really hard as one person while you're also trying to do another job to really get a good picture, and especially for something so niche that I suspected didn't exist, but I couldn't be sure about it because I didn't have the time. I've since colleagues of mine who work at UVic who are working on a research project with me for this have done a much broader literature review and have kind of confirmed that there doesn't seem to be any existence of a role like this throughout the world. And then, I used all of that sort of literature to inform this briefing note.
Wow, it sounds like there's a lot of potential to really expand the scope of this role internationally eventually.
Ideally, yeah. I think it's needed.
Wonderful. Thank you so much for sharing all of that. Next, I wanted to ask about your thoughts on ensuring dignity throughout the process of accessing healthcare, which can be a really big obstacle.
Yeah, it really can be. I think that, it depends on each individual patient. For people interacting with the healthcare system out there, you're probably going to have experiences. You might have really amazing nurses. You might have people that don't quite get it and say the wrong things. Oftentimes, I find that people want to do the right thing in the healthcare system, but don't have the knowledge or the support to do so, and the support for their own learning. There are, of course, malicious people out there that I find, tend to be the less often outcome. But I think just for providers that you can't know everything about every patient, but just taking the time to understand that everybody is presenting with a larger context. And I think we do to an extent, but it's really easy to get trapped in a cycle of burnout when we're working short, we're doing too much, and things that seem small to us, especially, me coming from the emergency room, everything seems small unless it's a big trauma drama, right? And so our perception becomes quite skewed, but our patients' perceptions are that their situation is quite large and quite concerning for them because it's affecting their daily life. And so to preserve dignity, a lot of the times I think it's, taking a step back, it's listening to people, asking respectful questions about how we can meet their goals, what are their goals, and just really trying to bring it back to being patient-centered as much as possible. But also understanding that patients that come from a multitude of equity-deserving backgrounds have a lot of distrust in the healthcare system for a lot of historical and valid reasons. And you are a part of that system. And so patients are going to feel uncomfortable, and it's going to take time for you to build rapport, even if you are an ally, even if you are an amazing person. They don't know that. I don't know that. So when I interact with you, I'm going to be more guarded initially. Whereas, I, in my role, can come up to a patient and we can we're starting on a different playing field, right? We're coming from a similar background. So that's not to say that you can become that, but just understand that you have a bit of a bigger sort of hill to climb to build a rapport with those patients.
Yeah. We really have to start with meeting people where they are and really becoming as self-aware as possible in the process, eh?
Absolutely, 100%.
We will be back with the second half of our interview with Emily Wyatt, RN, after a segment from Nicole and some statistics presented by Lauren. A Sound Constitution is a health-based radio show produced by local VIU Bachelors of Science in Nursing students, airing every Thursday from 2 to 3 p.m. here on CHLY 101.7 FM. We look to demystify and provide evidence-based information for you to make informed decisions about your health. Now we will hear from Nicole, who will provide us with more information about how to educate ourselves and be the best allies we can be for our gender diverse and trans community members.
Hello, I am Nicole, and I want to talk about allyship for the 2SLGBTQIA+ community, particularly in the context of healthcare. In this segment, we will be discussing why allyship is so important, what it means to be an ally in healthcare, some of the challenges this community faces, and how we, as future healthcare providers, can be better allies. As healthcare professionals, we have a responsibility to provide compassionate and equitable care to all patients. But for many in the 2SLGBTQIA+ community, accessing healthcare can be challenging due to discrimination, a lack of inclusive services, or providers who may not fully understand their needs. This is where being an ally comes in. Allyship is crucial in healthcare because it helps build trust, reduces barriers to care, and ensures that marginalized groups like the 2SLGBTQIA+ community receives the respectful, competent care they deserve. By being an ally, we can play an essential role in addressing healthcare inequities and advocating for change that makes healthcare safer and more inclusive. So to start, let's define allyship. The dictionary definition is someone that aligns with and supports a cause with another individual or group of people. A straight ally, more specifically, is an individual outside of the 2SLGBTQIA+ community that supports their fight for equality and rights. In healthcare, being an ally means more than just being supportive. It involves actively working to understand and meet the unique needs of this community, advocating for the rights and creating safe, inclusive spaces where patients feel respected and heard. Folks in the 2SLGBTQIA+ community face significant health inequalities. Research shows that people in this community are at higher risk for mental health challenges, substance use issues, and certain chronic diseases. Unfortunately, these individuals also face barriers when accessing healthcare services. Whether it's a lack of understanding from providers or fear of discrimination, these barriers can prevent patients from getting the care they need. Many individuals may not disclose their sexual orientation, behavior, or gender identity to their doctors. According to a 2019 House of Commons report, some sexual and gender minorities mentioned that they often needed to educate healthcare professionals about their specific health needs. Additionally, some healthcare workers may refuse to treat these individuals due to a lack of training, which can delay access to care. For those seeking gender-affirming surgeries, access varies by province, often requiring a letter of recommendation from a healthcare provider. This requirement can create financial barriers, as some providers, such as psychologists and psychotherapists, work privately. It has also been reported that long wait times for gender-affirming surgeries can increase the risk of depression, anxiety, and suicidal ideation among transgender individuals. Being an ally in healthcare means recognizing these disparities and actively working to eliminate them. It is about creating trust, which is vital for providing quality care. Patients who feel safe and understood are more likely to share personal health information, follow through on treatment plans, and seek care when they need it. So, how can we be better allies? Well, knowledge is power. Healthcare providers can stay current about the specific healthcare needs of the 2SLGBTQIA+ community. This means understanding the health disparities they face, as well as being aware of the discrimination and stigma that can impact their access to care. A good place to start here on Vancouver Island is connecting with local organizations that provide support and education. Island Health's Transgender Health Services provides education and training programs for healthcare staff to increase their knowledge and skills in providing transgender inclusive care. It includes cultural competency training, understanding gender-affirming care, and guidance on respecting pronouns and gender identity in clinical settings. As allies, we should take advantage of resources like these to make sure we're up to date with best practices when providing care to trans patients. Using resources like TransCare BC and Prism Wellness at AVI Health and Community Services can help provide more knowledgeable and inclusive care to patients. Healthcare professionals can turn to TransCare BC for education on how to provide the best possible clinic guidance to trans, two-spirit, and non-binary patients. AVI is a great local organization that supports harm reduction and offers healthcare services to marginalized communities, including the 2SLGBTQIA+ population. They provide sexual health services, HIV care, and other support for all patients, all in a non-judgmental, affirming environment. Love CRN, which stands for Living Out Visibly and Engaged, a community response network, is an online resource which offers a free 3-hour workshop, workbook, and related tools to help human services organizations become more affirming and inclusive of sexual and gender diverse clients and staff. There will be a link to all of these resources in our show notes on our Facebook, Instagram, and YouTube pages. Another key part of allyship is using inclusive language. For example, asking for a patient's pronouns and using them correctly shows respect for their identity. It may seem like a small action, but it can make a huge difference in making patients feel comfortable and affirmed. Intake forms in a healthcare setting should allow patients to self-identify their gender and provide their chosen name, even if it differs from their legal name. These small changes can make a big impact. Advocacy and allyship go hand in hand. By standing up for inclusive policies, we help make the healthcare system more equitable, so all patients feel valued and respected when they seek care. Being an ally isn't just about how we treat individual patients, it's about advocating for systemic change. In British Columbia and across Canada, there's still work to be done in terms of policy and access to care for the 2SLGBTQIA+ community. We need to push for inclusive healthcare policies that reduce barriers to care. For example, reducing waiting times for gender-affirming surgeries, advocating for more funding for 2SLGBTQIA+ health services, and ensuring that comprehensive health training is included in healthcare curriculums. Practicing holistic, patient-centered care is also crucial. 2SLGBTQIA+ patients may be dealing with unique stressors, such as family rejection or societal pressures, which all impact their health and well-being. In our healthcare interactions, it's essential to look beyond just physical health and consider the emotional and social context of our patients' lives. Here at Vancouver Island University, the Positive Space Alliance is dedicated to fostering an inclusive and supportive environment for 2SLGBTQIA+ students, staff, and faculty. It promotes awareness through education, advocates for safe spaces across campus, and encourages allyship by providing resources and training to create a more respectful and inclusive university community. Here are some ways in which you can take steps in your personal lives to be an ally to the 2SLGBTQIA+ community. Avoid making assumptions about someone's sexual orientation or gender based on appearance. Use gender-inclusive language until you know someone's preference. Speak up when you witness discriminatory or exclusionary behavior. Share your pronouns. Respect other people's pronouns and preferred names. Be willing to learn from mistakes. If someone corrects your language or actions, apologize and move on. And most importantly, continue to learn about 2SLGBTQIA+ issues and challenges to help you become a more informed and empathetic ally and create a space where everyone feels safe and respected. To summarize, allyship in healthcare isn't just about being accepting. It's about taking action. It's about educating ourselves on the unique needs of this community, using inclusive language, advocating for our patients, and pushing for systemic changes that make healthcare more accessible and welcoming. Thank you for listening. I hope this discussion has inspired you to reflect on how you can be a better ally to the 2SLGBTQIA+ community in your life.
Thanks, Nicole, for that great segment. Now we will hear from Lauren, who will provide us with an overview of relevant statistics regarding our gender diverse and trans community in Canada.
Hi listeners, it's Lauren here with some statistics about the Canadian population of people belonging to the 2SLGBTQIA+ community. According to the 2021 Canadian Census, 1,289,300 people reported that they identified as 2SLGBTQIA+. Also, the 2021 Canadian Census reports that for persons aged 15 to 24, there are 31,240 non-binary persons and 31,315 people identifying as transgender in Canada. For the age group over 35, there are 10,110 non-binary persons and 28,145 people identifying as transgender. According to the 2018 Survey of Safety in Public and Private Spaces, 2SLGBTQIA+ population is relatively young. Youth aged 15 to 24 made up 30% of the 2SLGBTQIA+ population, compared with 14% of the non-2SLGBTQIA population. A study entitled Healthcare Access Among Transgender and Non-Binary People in Canada, 2019, a cross-sectional survey, reported on 5 assessed health outcomes for this population, namely having a primary care provider, having a primary care provider with whom the respondent was comfortable discussing trans health issues, past year unmet healthcare need, medical gender affirmation status, and being on a waitlist to access gender-affirming medical care. 81.4% of participants had a primary care provider, 52.3% of trans and non-binary participants had a primary care provider with whom they felt mostly or very comfortable discussing trans health issues. 44% reported a past year unmet need, with more than 1/3 predicted to have unmet needs in every province or region. 35.4% had completed gender-affirming medical treatments, and 40.7% reported they were on a waitlist for gender-affirming care. Nationally, of 416 participants on a waitlist for gender-affirming care, 82% were waiting for surgery, 14.9% for a mental health assessment, 13.2% for hormone therapy, and 0.5% for puberty blockers. Participants reported considerable unmet needs or delays in primary, general, and gender-affirming care, with significant regional variation. The results indicate that, despite efforts toward equity and access to care for trans and non-binary people in Canada, inequities persist. Thank you for listening to this segment on Canadian statistics centering on the 2SLGBTQIA+ population in Canada. All references can be found in our show notes on our Instagram and Facebook pages.
Thanks to Lauren for sharing all of that statistical information with us. Are you curious about trending health topics in your community? Do you want to learn more about how you can better your own health? Listen to A Sound Constitution on CHLY 101.7 FM every Thursday from 2 to 3 p.m. Our next segment is brought to us by Geo Neptune, who will explore the history of the term Two-Spirit and who it pertains to, from a YouTube channel called Them.
Though the label has only been used since the 90s, the concept of the Two-Spirit is something Indigenous groups have identified with for centuries. But what does Two-Spirit actually mean, and where does it come from? So what is Two-Spirit? It's an umbrella term that bridges Indigenous and Western understandings of gender and sexuality. You may recognize it as the two that sometimes appears on the end of LGBTQ2. There are many definitions and understandings of Two-Spirit, and each is nation-specific. The term was intentionally introduced by Native people with the goal of finding common ground and helping educate about traditional teachings in a contemporary context. The Two-Spirit Society of Denver offers the following definition. Two-Spirit refers to another gender role believed to be common among most, if not all, First Peoples of Turtle Island, North America, one that had a proper and accepted place within Native societies. This acceptance was rooted in the spiritual teachings that say all life is sacred. So how did the term Two-Spirit first come about? In 1990, in Winnipeg, Manitoba, Canada, at the 3rd Annual Native American Gay and Lesbian Gathering, the term Two-Spirit was proposed and affirmed by consensus. The word was a potential solution to what Native scholars and activists called the problem of naming, or making the many different sexual and gender identities that fall under the Two-Spirit umbrella legible across Native and non-Native cultures alike. For example, to illustrate the diversity of meanings that Two-Spirit contains, consider the following. In Lakota, the word winkte means to be as a woman and refers to two-souled Lakota people who transgress boundaries of gender from what may be considered male to female. In Dene, nadlehe means those who transform and refers to one of 4 separate genders: masculine-feminine, masculine-masculine, feminine-masculine, and feminine-feminine. Each gender has its own word in the Dene language. And those are just 2 nation-specific examples. There are so many more. Each nation's understanding of gender and sexual diversity is different and grounded in specific spiritual beliefs. Although all nations don't have a concept of Two-Spirit people, across those indigenous nations that do, Two-Spirit people were historically held in high regard and often considered sacred or divine, holding important positions like matchmakers, medicine people, or warriors on the front lines of battle. Many Two-Spirit people perform roles traditionally assigned to both men and women. Witwa, a famous Two-Spirit of the Zuni or Ihamana, was known to take part in masculine tribal matters and feminine tribal matters, and was even sent as an official Zuni delegate to Washington, D.C. Part of the reason Two-Spirit was adopted at the 1990 conference was because much of the written record on the indigenous nations of North America begins with European contact. For instance, the writings of Jesuit priests from the 1600s contain references to berdaches, which means kept boy in French, to refer to those who embodied both male and female genders. These writings often focus negatively on perceived cross-dressing among the Anishinaabe. The term is not only inaccurate in that it projects a European understanding of gender, but is widely considered pejorative by natives. Two-Spirit was an attempt at self-determination across linguistic barriers, because the existing language, foreign and imposed violently on the indigenous peoples of North America, was both offensive and deeply colonial in its gaze. European colonizers imposed homophobia, rigid binary gender roles, and misogyny under the guise of civilizing indigenous people through the Christian tradition in residential schools and beyond. As a result, indigenous people were robbed not only of their land, but of their spiritual traditions and way of life regarding Two-Spirit people. Many nations came to forbid and punish Two-Spirit unions and self-expression. As recently as 2004, Kathy Reynolds and Dawn McKinley, 2 Cherokee women in Tulsa, Oklahoma, attempted to marry under tribal law, setting off a convoluted legal battle with serious political and social implications. The 2 were thrust into the spotlight against their wishes and became instant public symbols of the battle for Two-Spirit rights under tribal law. The Cherokee tribe is the 2nd largest in the U.S. Although they were granted the right to marry, the decision to issue them a marriage license was soon challenged and led to a tribal law declaring that a union was to be between a man and a woman. Eventually, in 2016, the law was overturned. By that time, a wider cultural shift had taken place, both outside of and within the Cherokee Nation. In recent years, many Native people are returning to their Two-Spirit traditions as a way to heal from the injustices the American colonial project has visited upon their ancestors and traditions. In 2011, the first known U.S. Two-Spirit powwow was organized by the Bay Area American Indian Two-Spirits. Since then, powwows honoring Two-Spirits have been held in Montana and Kansas. And in March of 2017, the largest powwow in the U.S., the Gathering of Nations, honored Two-Spirit people during its grand entry. Two-Spirit identity is resilient and precious. It has survived centuries of colonial violence and prejudice. These sacred ways of knowing live on amongst Native youth seeking to know more about themselves, elders who have kept the traditions alive in spite of the odds, and anyone in between. It should go without saying, but Two-Spirit is not a poetic way for non-Native LGBTQ people to express themselves. It is, however, a sacred tradition among the first peoples of this land we call Turtle Island that all of its inhabitants should know about and respect.
Welcome back to our interview with Emily Wyatt, RN. I'm wondering, are there any plans for more liaison nurses yet?
Yes. So a big part of the research that we're doing with my colleagues at UVic is to essentially look at the implementation of this role in other areas, starting with throughout the province and different health authorities. Within Island Health, we're presently trying to get another position set up at Victoria General, so that there'll be 2 in the South Island region. And with the long-term sort of idea is to, at the very least, have a position in each region. So like Central Island and North Island would have at least one person to cover their sites, because what we've seen is huge impacts to patient care. So one of the things we wanted to look at is a patient's likeliness to access care when appropriate. So from essentially, I will only come in if it's by force, kind of the implication being through police or ambulance, versus I would come for any appropriate reason. And we've seen patients score after having interaction with the service. We see patients score about roughly 30% more likely to come to the hospital for any appropriate reason, which is huge on its own. But the other more mind-blowing thing, if you talk about statistical significance, is what we've seen is in quality of care and safety. Patients have rated, after having the service involved in their care, around 70% higher quality of care and safety, which is, a small number.
That is so wonderful to hear.
Yeah.
Stats are matching up. I love it.
Yes, yeah, it's awesome to collect that data, and I'm glad that we have the funding to do it in a more kind of holistic way through UVic and collect even more of those experiences, because I think that will really drive home the big thing. And I think that as this expands, we're still in this sort of phase where a lot of nurses, even in the hospital that I work at, where the physicians or other care providers aren't aware that this service exists.
Yeah.
It's just been under a year since we've been officially running it, but it's hard to keep track of all these things. And also members of the community not knowing, that it exists. And a lot of the times, I've had patients say to me, well, I didn't really see what you'd be able to help me with. And then we connected, and I felt so much more supported and heard, and like a plan was formed together. So I think there's a lot of learning for patients and providers around this new service, learning that it exists and what it can kind of provide them. And we saw the same thing when the Indigenous liaison nurses were starting a few years ago as well, as it just takes time to build that knowledge.
Oh, there's so much potential. So I wanted to ask you as well, can you tell us a little bit about the barriers that you anticipate in terms of expanding this role? And perhaps if you could tell us a little bit about any obstacles you might have encountered during the process of establishing your role.
Yeah, I think in terms of barriers, it always comes down to essentially politics and funding. Figuring out like who's going to pay for this, who's going to agree to pay for it, for how long, is one of the biggest things I think presently. We were really quick to get this actually established. I really just had the right people that I engaged with at the right time. I was very fortunate. But getting something started like this is often easier than it continuing on in an ongoing way, because everyone is happy to make a big, like, look what we've done, look how cool it is. And then it's not as exciting to announce, oh, we're continuing to do this thing. And so keeping that energy, that momentum is really important. And, not to be overly political, but when it comes down to funding for a lot of things, from our service to Indigenous health services to addictions medicine services, and we're also starting a pilot down here for some colleagues of mine that are doing an addictions liaison nurse kind of sort of role. All of these things, I think, have huge potential to both save the health authority money, improve healthcare outcomes and quality of care, but also patient experiences. The thing is, though, depending on who is elected, the political will to continue funding such initiatives can be quite tumultuous. And I think that's probably, looking forward, one of my biggest concerns for a lot of these things.
Yeah, that makes perfect sense, especially with elections coming up these days. Yeah.
Mm-hmm.
Now, what do you believe will be next in terms of policy, research, and protocol in this area of healthcare? And you've told us a little bit about some of the research so far. Just anything you want to add?
Yeah, I mean, researching the implementation, the rollout of this position, I think will be huge. But I really, like, long term, would like to see more initiatives for community health, where care is being provided by people from that community for that community, but also that we're actually ensuring appropriate access to care. There's so many things, in terms of the trans community, that are not funded. There isn't the option for certain procedures and surgeries and medications to be funded. The way that they're funded is not, put in MSP very well. And there's also just not a lot of research into outcomes. There's not obviously the money for big companies to look into this, for pharmaceutical companies. Like, it's a relatively small population. And so a lot of the times, myself and my peers in the queer community, we become the sort of experts in our own health, which for some of us is easier than others. But there's so many gray areas, and even I, who have done so much learning in this area, there are situations that I come across where it's like, there isn't an answer. And we have to tell that to patients, that we genuinely don't know. We're essentially kind of just throwing things at the wall, and to an extent kind of experimenting on you.
And I'm wondering, how can the public find out more information and learn more about advocacy for our Two-Spirit LGBTQIA plus community members, and how to most effectively act as an ally?
Mm-hmm. Obviously it's going to depend on the region. I'm down here in Victoria, so some of our resources are a little bit different. But essentially, like, looking into your local Pride Society, Community has really good resources for patients and allies. But if I'm honest, I think the biggest thing is that an ally can do, beyond their own learning journey, and taking charge of that, and learning our history, learning from members of your community, engaging with them in meaningful, respectful ways. I think the biggest, most impactful thing you can do is elevate the voices from that community. We don't necessarily need people to speak for us. We need people to listen, and we need people to give us ways to spread our message and to talk directly. I think that a lot of times people are very well-meaning, and it's very loved and appreciated by the community. But talking about our own experiences, talking about our own stories, is so much more of a powerful way to get people to understand why this is critical. And the only people that can talk about their own stories is people from the queer and trans community who have those stories and experiences.
Well, I, for one, just want to thank you for sharing your story and allowing us at Out of Sound's Constitution to elevate your voice.
Of course, of course. No, I'm so happy for this opportunity. Thank you.
And just to close things up here, is there anything else you would like to share with our listeners today?
Oh, I mean, many things, but we don't have all day. So, I think that the thing is, I would encourage people to, when you hear about initiatives like this, just speak up, talk to your local like MLAs, your local island health directors and VPs, and have your voice heard. This is mostly broadcasting in Nanaimo, where this role doesn't exist. And if this sounds like something that you think either you or a family member or a colleague or whomever in your life would benefit from expanding up there, the best way to do that is to not be quiet about it, to ask for it, because then we can collect that information, we can collect that data, and we can make this a reality. These things, all of this work is happening, but it really helps for people to be using their voice as both allies and members of this community to demand better and not just be happy with any level of care that we can receive, but instead the best level of care that we can receive.
Well, once again, I just want to thank you so much for your time and sharing all of your knowledge with us. We really, really appreciate your time, and thank you so much.
Absolutely, anytime.
We want to extend a big thank you to Emily Wyatt for sharing her knowledge with our listeners today. I would also like to thank my co-hosts, Jamie, Lauren, and Nicole, for sharing their segments. Finally, thank you so much to our listeners for tuning into our episode today. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY, A Sound Constitution, or our Twitter at ASC_VIU. If you've missed parts of this episode, or would like to listen to this episode or episodes from our past shows, check out our YouTube at A Sound Constitution. Otherwise, we'll see you all next week.